Through the fog of skyrocketing deaths from preventable diseases, as ambitious politicians battle for power ahead of 2023, ordinary Nigerians are confronted with the stark reality of their country's broken healthcare system. Truth be told, Nigeria's healthcare infrastructure is one of the worst in the world, and for decades no government has paid much attention to it, in spite of the fact that virtually every day there are coruscating warnings from the World Health Organization and from local health officials that after years of corruption and neglect, this country is in a healthcare crisis and cannot afford to continue with business as usual. So, as the politicians vying for the keys to Aso Rock in 2023 promise to transform Nigeria, how much will they support healthcare by investing heavily in the sector in a country that desperately needs to strengthen things like primary healthcare facilities, intensive care units, laboratory capacity, and emergency medical systems? Well, for more on this, I'm joined now from Ibadan by the respected Nigerian Professor of Virology and Chairman of BioVaccines Nigeria Limited, Dr. Prof Tomori, who's also a member of the WHO's Technical Advisory Committee, and from our studios in Lagos by the President and CEO of BioVentures for Global Health, Jennifer Dent. Thank you very much indeed to both of you for joining us. Let me start with you, Professor Tomori, because you've been speaking publicly about healthcare in Nigeria, healthcare and politics. You've said that the improvement of the healthcare system in this country must be number one on the priority list of each political party. Are you satisfied that it's getting or will likely get the attention it needs?
No, so far, thank you very much for this opportunity. So far, I don't think we are getting the attention that health needs. And I think it's a major problem because all of the plans they have depends on the health of the people. If the people are not healthy, then forget all the stories they are telling us. If they don't put their emphasis on improving the health of the people, then we are in for a very terrible time. We're already in terrible time. So I think it's going to get worse if they don't put all the efforts on it.
Okay, well, right, okay, we seem to have lost a bit of your audio there, but let me come to you, Jennifer Dent in Lagos. Thank you for joining us. We'll talk a little bit later about what you're doing in this country with regard to things like cancer and so on. But of course, as we found from COVID-19 and the lessons from that, the issue of public health in any country is inextricably linked to the economy. So neglecting the healthcare system is laying the foundation for the destruction of the economy, isn't it?
It really is, Charles. And we've just looked this past week about the economic loss to a country like Nigeria. $5 billion was quoted based on economic loss because of cancer care alone. So there's a real benefit, and there's data to show that a country like Nigeria would benefit tremendously by improving the healthcare system and improving basic access to medicines and technologies and access, but also importantly, looking at cancer and therapeutic areas where Nigerians and African patients are disproportionately impacted by cancer, also thinking about innovative medicines and technologies and working with international companies.
Well, thank you for that. That gives us an idea of at least one area where there's a considerably big affliction that's hitting this country. Professor Tomori, just set out for us the state of healthcare in Nigeria in kind of broader terms at the moment. What are some of the health statistics that give you cause for concern?
Thank you very much. I think when you look at the WHO figures, about the issue of child mortality in the country, under 5, and infant mortality. It's not something for us to be proud about. We are one of the few countries at the bottom of the rack. And I think this is something, I know we'll be making efforts, but then the efforts are not just meeting us. And remember, we did not make the MDGs, nor are we likely to make the SDG, because these are some of the factors. How many of our children are out of school? All those kind of factors are what is happening. And unless we address these issues now, and the coming parties that are coming in begin to address it, then we're going to be in a problem. You remember what COVID did to us? Our economy was going down the drain before. COVID came and buried it. And if we don't prepare for another one is going to come, whether we like it or not, and we better get prepared now. The time of COVID, when it started, we were totally unprepared. Yes, maybe over the months, we have made some progress, but now that COVID seems to be going, we're going back to where we came from. All of the committees that the government set up, the ST steering committee, they're not steering anything anymore. Everybody's forgotten about it. We're back to square one.
Yes, and I think that's an important message to send out there, not just to the current government, but also to any new government that's coming in. And you've underlined the importance of that political message. And Jennifer Dent, of course, among those alarming statistics that Professor Tomori was talking about, and you also touched on at the outset, the number of people who are dying from cancer, which is now estimated to be higher than people dying from malaria. What sort of challenge does this dramatic shift from the burden of infectious diseases such as malaria to non-communicable diseases such as cancer represent to health systems in this country?
Well, you talk about an economic impact, and there's been most of the investment in a country like Nigeria has been focused on infectious diseases historically. And now there is a paradigm shift. And when you look at non-communicable diseases like cardiovascular disease, cancer, there's got to be a focus on building more specialty capabilities, but also skills for the healthcare professionals, because this is a different set of skills and infrastructure and access that the country's hospitals need and the healthcare professionals treating cancer patients need to have access to, so that they can expand their knowledge. And as you said, the system can be designed to diagnose cancer patients early at the community level, at the state hospital level, and actually triage those patients into leading cancer centers. Like here in Lagos, I was at the Nigeria Sovereign Investment Authority Lagos University Teaching Hospital Cancer Center, where they currently have the latest radiotherapy equipment. They have 3 new linear accelerators to deliver the best radiotherapy to cancer patients in the country. And that's a huge investment that the government has made in providing cancer care. But we were talking about what Nigeria needs to service its cancer patients, and that's only really the tip of the iceberg of what needs to be invested in the country to provide the care and the treatment to cancer patients. And it's much more complex than some of the infectious diseases that the country has built capacity to treat. And there's been international partnership and support to invest in those infectious diseases. I think the country needs to shift. The new government needs to think about the current impact on the population of diseases and make smart investments. Those investments can be driven by economic data of providing the health care that the Nigerian population needs. And I've heard that the younger population is really driving and demanding change, including excellent access to really all treatments and the same care here in Nigeria as we get in the United States, for instance.
Well, those are very important points you make, and I do hope that the politicians across all the political parties are listening. I mean, we will come back and talk to you a little bit more about what you're actually doing with regard to cancer and so on through your company and through your African Access Initiative. But let me come to you, Professor Tomori. Let's take something like malaria deaths, which account for around, from what I understand, 11% or so of the mortality rate in Nigeria. You have said publicly and repeatedly that most of these deaths could have been avoided with improved access to healthcare services, proper hygiene and sensitization. But this has not been the priority of Nigerian politicians. With this current election campaign, do you think there is the opportunity not only to make the presidential candidates aware of these deplorable figures, to use your words, but to make them tell voters what they'll do to improve the situation?
Thank you very much. I think you're raising a very, very important point. This is a unique opportunity, this type of program like this. I hope they're all listening. It's time for them to arise from their slumber and get up and get us into a situation where things can be better for our people in this country. You mentioned the infectious diseases. I mean, these are the ones. I mean, for ages, you can name them, so many. Yellow fever, polio. Yeah, we said we overcome polio, but we still have polio cases going on due to some other diseases. We have now we have monkeypox. We just finished with COVID. So there's a plethora of all these infectious diseases that are around, which our people need to do. And yet, it is, as you said, it is possible with a little investment, into with international aid. I personally don't really believe that our emphasis should be on international assistance. We have enough resources in this country to take care of our infectious disease problem by putting in the infrastructures that we need, the hospitals, the laboratories, and all the resources that are needed. And you remember during COVID, Nigeria was able to raise 500 billion or something, which they said they invested on COVID. The question is, where has that gone to? COVID is over. It doesn't mean that's the end of the story. Epidemics, you can't take holidays from epidemics. You always continue to, it's a continuous exercise. Part of our problem is that we don't sustain what we've done. When COVID came, we started with just 4 laboratories. Now, over that period, we built up the laboratories to about 100 and something. But today, if you go and check the records, half of those laboratories are no longer functioning. And those are the problems we are having. And those are the problems we need our leaders to take care of, to be sure that, so what we put up is sustained, and in such a way that when the next epidemic comes, we are prepared. And there are many of them coming.
And I would urge Nigerian politicians and people who are in charge of these things to listen very carefully to Professor Tomori, because not only is he one of the most respected virologists on the African continent, he is also a member of the World Health Organization's Technical Advisory Committee on COVID-19. But let me come to you, Jennifer Dent in Lagos. Part of what politicians must and should do is to increase their budgetary allocation for healthcare and also show some creativity and resourcefulness in seeking additional and alternative sources of funds to improve healthcare services in this country. So perhaps reach out to the African Access Initiative that you are part of, that international consortium, and of course your own company, BioVentures for Global Health, as part of efforts to address Nigeria's cancer crisis, for instance.
That's right, Charles, and I couldn't agree more with what Professor Tomori mentioned about there's been such an investment in a short period of time in responding to the COVID-19 pandemic. And if that investment could be made to really create sustainable healthcare for all Nigerians across infectious diseases, but cancers, I mean, that would make such an important difference. And what we're doing, and the reason that I'm here in Nigeria for this past week, is there was the launch of the Lancet Commission on Cancer for Sub-Saharan Africa event, which was intended to speak to the politicians about 13 recommendations coming from that publication, which was led by international cancer experts, including more than half from the African continent, to call out for the investment. Research is also critically important. And through our African Access Initiative and working with international companies like Takeda Pharmaceuticals, Johnson & Johnson or Janssen Oncology, Bristol Myers Squibb, those companies are companies that want to invest in partnership with governments in Nigeria to build capacity and to train healthcare professionals, and also to make sure that patients have a pathway to better cancer care in Nigeria. We're also working with those companies to get their innovative drugs, where those drugs are safe and proven efficacious in Nigerian patients, to get those drugs into the country and accessible at a much more affordable price for patients in the country. And we've worked with the Director General of NAFDAC, Professor Moji Adeyeyi, and her team to train her healthcare professionals on how to review clinical trials so that NAFDAC can monitor, as their role is, new medicines that are coming in and make informed decisions on studies in Nigerian populations on how Nigerian patients are responding, and not relying on data that's generated in Caucasians or other populations who have different genetic profiles. So I think that's another critical component, building capacity at the agency level in Nigeria, but also at the hospital level, which we're working with international companies to do, and facilitating research to help to build the capabilities of the healthcare professionals and actually implement research that Nigerian oncologists are prioritizing.
Well, I have to commend you, Jennifer, for the work that you're doing and the initiative that you've taken. I mean, it really is astonishing that someone who is not Nigerian comes here to raise this amount of concern and focus on a problem that is Nigerian and that Nigerian leaders ought to be focusing on. So, and of course, Professor Tomori has been banging that same drum for a very, very long time. And as the campaigns progress, Professor Tomori, and the public demand a focus on the issues, I mean, we're seeing much more of that demand this time than ever before. Do you expect that improving healthcare will be on the front burner and something positive is likely to emerge as a result of the 2023 election?
Thank you very much. We have to make it their focus. It is not enough doing all the $1 million or million matches all over the place. We must engage them at a different level. We must be involved with what is the manifesto they are giving out. They don't address health, we should point it out to them. A few of our colleagues, we should write out position papers to address those issues so that we bring it to their attention. Those of them who are in the parties, who are educated, we need to contact them and tell them this is where we need to go. All the economy you're talking about, if you don't have health or if you have just one disease, you can wipe out everything that they are trying to build. Why build bridges where there's nobody to ride on the road? Where you have your people. I mean, see what happened with us during the COVID. So, two things. Both what you are doing right now as the rights, we need to engage these people in more serious issues, not all the things they are talking about, not all the galley matches and things they are doing. We need to get down to the basic facts of what is happening, the health issues. I've repeated it, more of TV and media involvement. Those of us who are also outside, writing more report for them to look at what are the situations, making suggestions on how to do it. And many of our colleagues, the youth, who are spending the time on the website or whatever it is they call it, on the social media, they should begin to focus on those issues also, and not just hailing the people and hailing them and following them all over the whole place. Tell them your life, my life, depends on it. If they're listening to you and they're making use of you now, then make use of them also for the good of the country.
Well, I couldn't have said it better myself. And on that note, I want to thank you very much indeed, Professor Oyawole Tomori, who is, of course, a Nigerian professor of virology, chairman of BioVaccines Nigeria Limited, and a member of the WHO's Technical Advisory Committee, who was talking to us there from Ibadan. And, of course, from our studios in Lagos, the president and CEO of BioVentures for Global Health, Jennifer Dent. Thank you very much indeed to both of you.